16-year-old female. She is a basketball player, has a history of a patella dislocation that she sustained about 2 years ago and has had persistent subluxations and also dislocations since her initial injury. So the treatment up to this point, I saw her for the first time, had been some physical therapy. She had been in a brace that helps to hold the kneecap in position, but she was still complaining of instability episodes, which was really limiting her ability to play basketball. So I'm going to go ahead and show you some imaging from her knee. This is the MRI scan of her knee, just to orient you. This is her patella. This is her medial femoral condyle. This is the intercondylar notch. This is the lateral femoral condyle, and this is her gastrocsoleus muscle behind. So you see this area of whiteness. This is where the kneecap popped out laterally. As it was trying to pop back in, it bangs against the lateral femoral condyle, causing this bone bruise, and then popped back into the femoral groove. I'm just going to scroll through this MRI scan. So this looks pretty normal here on the lateral femoral condyle. Now you can see where this area of bone bruising or bone contusion is, and that's actually bleeding into the bone. You can see it here, just not quite as prominent. That was her MRI scan where you can see there's a bone bruise where the patella dislocated laterally, ended up hitting the lateral side of the distal femur, causing the bone bruise. Now I'm going to go ahead and show you what her knee looks like in surgery. Because she'd already failed comprehensive course of conservative treatment, which was PT and a patella tracking brace, I ended up taking her to surgery to perform a medial patellofemoral ligament reconstruction. So this set of images would be intraoperative images during the procedure. I'm pushing on her patella laterally, and you can see it dislocate, and then it pops back in medially. So this is where the medial patellofemoral ligament lives. Hers is torn, and you can see how her kneecap pops out, pops back in. So I'm going to reconstruct a new ligament that'll go from the patella into the femur. This is the graft that I'm going to use to reconstruct her medial patellofemoral ligament. It is an allograft of a hamstring. I now have the graft sutured into the patella. I'm now tugging on the new medial patellofemoral ligament. Her patella is now very stable after the new medial patellofemoral ligament. Her surgery went great. Her kneecap is nice and stable, should not dislocate again. She will be in a hinged knee brace, which I'll limit her range of motion for about 6 weeks. And then the work starts on her part. We get her into physical therapy, really focus on strengthening what's called her VMO, which is this little muscle right here, which the physical therapist will work to restore, and we'll get her range of motion back. We'll get her back to basketball, and she should do great.